Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Sabah University Hospital, professor of medicine, University of Khartoum, dean of Sama Institute of Health. We are still doing our sessions about patient safety. This session is about understanding and learning from errors. Learning objectives of this session explain the term errors, violation, near miss, hindsight bias, understand the nature of error and how healthcare can learn from error to improve patient safety, know the ways to learn from error, and practice strategies to reduce errors. First, let us define what is error. Simple definition, doing the wrong thing when meaning to do the right thing. A more formal definition is planned sequences of mental or physical activities that fail to achieve their intended outcomes when these failure cannot be attributed to other factor or interventions. There is a difference between error and violation. So error when we do something uh, expecting that it is the right thing, but it tend to be the wrong thing. An error could be defined as commission error and omission error. Error may occur when wrong thing is done. This is commission. So you can observe uh, the person doing the wrong thing. This is what we call slips. For example, if I want to push a button and I push a wrong button. Omission, it is a memory lapse. So you don't recognize, you don't remember. For example, a patient with at risk of DVT and I forget to write prophylaxis. This is omission error or a lapse, or I forget to give a medication at the intended time. While violation is a deliberate form of action when we deviate intentionally from protocol or standard of care. Errors and outcome. Errors and outcome are not linked. Sometimes patient can experience harm even if he receives the right and correct treatment. For example, you give a medication like, for example, ACE inhibitors, lisinopril, and it leads to angioedema. That is unavoidable harm. But if we know from his record he has an allergy, if you give it, then that is could be an error or a mistake, depend on the context. Many patients experience or receive errors, but it will not lead to harm because the error is minor, is trivial. For example, giving a 4 unit of insulin to someone who is healthy, it might not lead to any consequences. Or if you recognize it early and you implement preventive measures, then you can mitigate and reduce the effect of that error. So patient can experience harm without any error. Receiving good treatment, he gets harm, and patient can get exposed to medical error and he get harm or injury, or he cannot get that. Human factor are very important. Error is inevitable downside of having a brain. One definition of human error is human nature. All of us we make mistake, regardless of our experience, intelligence, motivation, vigilance. We make mistakes. All of us we can reflect ourselves, and you can see sometime you try to open the car with the your apartment key, or you put your for example, the milk, instead of putting it in the fridge, you put it in the wrong place. Many of us experience this. When you drive, you make a lot of silly mistakes and turns. Mistakes, it is failure that occur when intended action is actually incorrect. Mistake is failure of planning. The plan is primarily wrong. There are two types. It could be rule based or knowledge based. Rule based, when the wrong rule is applied. For example, of rule-based mistake, um, getting the diagnosis wrong, and then you're gonna make the plan wrong. For example, if I get a young man, 22, with chest pain, and because he's young, I'm gonna assume it is gastroesophageal reflux disease, and I treat him as that, and it tend to be myocardial infarction. This is an example of rule-based mistake. Why knowledge-based? When clinician does not take the correct course of action, knowledge-based mistake tend to occur when healthcare provider are confronted with unfamiliar clinical situation. So when we have an error, this is what we call a skill-based error. It could be slips or lapse. Slips, you see an action, it's an action, while lapse is a memory defect. Mistakes could be rule-based mistake or knowledge-based mistake. And we mentioned that violation if you do the thing intentionally, when you don't follow the protocol or the procedures. As human, uh, there are situations that increase our tendency to make errors when we are not familiar with the task. If you get a patient with hip surgery admitted to gynecological ward, so they might not be familiar of handling this patient. So this increases the tendency of making an error. Uh, Inexperience, young provider, especially when they don't ask, when they are not supervised, they can commit a lot of errors. When there is pressure of time, people sometimes they find it is, yes, it's okay not to do the hand hygiene. Inadequate checking. In blood transfusion, it should be checked by two people. So if you don't do the redundancy, then there is a chance of making an error in high risk medication, or even if you don't check the record, or even if you don't check the vital sign before certain medication. When the information are not adequate, when they are not documented, or even the record is not available, and also when there is poor human equipment interface. These are situations that increase the tendency of making error, but also we have individual factor increase our tendency to make error when we have limited memory capacity, and this can further be reduced by fatigue, stress, hunger, illness, when there is a language barrier between you and your patient, and when there is a hazardous situation. And also limited memory, because sometimes you don't have the information. If you are a fresh and frontline provider, sometimes you get new tasks, new procedures, so you need to learn about them, you need to rehearse them, you need to see them in a video or to see someone doing them. And whenever you are not comfortable or unfamiliar, ask for help. There are situations like hunger, when you are hungry, angry, late, or tired. These can tend to increase your tendency of making error. So hungry, angry, late, and tired. In aviation, they use this word "I am safe," reflecting that I have no illness. I'm not in medication that can impair my judgment, like narcotics or benzodiazepine or any medication that cause sedation. I'm not stressed. I'm not in alcohol or drug. I'm not fatigued, and I'm not in any emotional distress. So I am safe, so I can practice well. If you are experiencing any one of these, you have to know how to manage it, and you have to consult your team or your supervisor so that you can mitigate this situation. Sometimes they can get help, give you some rest, or get someone else to replace you. So human can make mistake, error can happen, and whenever errors happen, then we need to learn from them. One of the way to do that is about writing incidents report. This is about collecting and analyzing information about any event that could have harmed or did harm anyone in the future in the organization. A fundamental component of an organization ability to learn from error. So incident report is a resource for learning, but it is very important to look at them from system perspective rather from provider perspective. You have to avoid shame and blame, and you have to figure out system defects so you can correct them in the future. Primary function of incidents reporting system is to identify recurrent problem, what James Reasons calls them error traps. Identifying and removing this trap is one of the main function of error management. So when error happen, there are many factors. Yeah, there are individual activity, but many times there is task factor, there is environmental factor, organization culture. All these are discussed detail in root cause analysis, but the objective is to analyze and figure out system factor and try to remove them. In order to have a good error analysis and incidence analysis, you should have culture of safety. Culture is about shared values, belief, attitudes that interact together to make institutional culture. So it works with in organization structure and control system and produce the behavior or what we call the organization norm. So people when come to your institute, they come with their own behavior. So they need to be onboarded so that they can learn about the behavior in your institute. So for you as individual, sometimes it's difficult to change the world as a junior doctor, but there are some activity you can do so that you can challenge the unsafe practice. When we discuss the culture of safety, they are organization and leadership responsibility, but as an individual also you have your responsibility to address safety by having a positive tone, by working in a team, by recognizing error and try to identify them and report them. Whenever we are doing incidents analysis, it has to be analyzed by interprofessional team who are experienced in the process, and the report should be anonymous and should be done in timely manner, and also feedback should be given to those who are involved in the incidents. Corrective measure should be suggested and implemented and should be measured to make sure we are doing the right thing to correct and improve the system. One of the way to address error is after we get the incident report is to do what we call root cause analysis. There are different kind of root cause analysis and system analysis. One of them is developed by Veteran Affairs National Center for Patient Safety. In this system, they are trying to answer these questions: what happened, who was involved, when did it happen, where did it happen, how severe was the actual or potential harm, and you need to measure the harm and you need to address your patient and you need to implement monitoring and treatment. And also you have to look at the incidence and to see the likelihood of recurrence, and and also to look at the consequences, and then you need to figure preventive measures and to implement them and to measure that they are working. When we look at these from system perspective, sometimes we need to improve our communication, structure communication, team communication, communication in the transitional zone. Staff, if they have a gap in their skills, they might need to get some training. Also, we need to counsel our staff about how to handle fatigue. When we mention that I am safe, illness, fatigue or drug or so. And also we should have a system procedure to handle staff shortage and competing priorities, and to improve environment human equipment interaction. At the same time, we have to have rule policy and procedures, and we should set barriers that it prevent these harm to happen again. So As individual, there are some measures you can do to reduce error. Know yourself, know your abilities, your limitation. Always when you come to work, you need to be well rested, eat well, sleep well, and dress well, comfortable shoes. And you, when you are going to a different new department, know the environment, know the people there, know their protocol, and how do they do things there, know their culture, and learn from them. Use a friendly positive tone. You have to be familiar with the task. For any new task, you read about it, you see it in a video, you see someone doing it before doing it yourself. And you need to get the privilege for doing that by yourself. And also build checks into your routine. You check any procedure before giving certain medication. You need to check the vital signs. You need to check the step of the process. And whenever you don't know, ask for help. And also consider that error can happen anytime, and you need to be vigilant to recognize them. And whenever you recognize them, you need to report them so that we can learn from that. Medical errors are complex issue, but error itself is an inevitable part of human condition. Being human, definitely there are error. Learning from error is more productive if it is considered at, at an organization level. Root cause analysis is highly structured system approach to incident analysis, and it provides us with corrective and preventive measures to mitigate the situation in the future. And thank you.